Bismillahirrahmanirrahim. In quote for the day, Allah says in Holy Quran, if Allah knows any good in your hearts, He will give you something better than what was taken from you. The topic for today's presentation is health policy. I am Dr. Ayesha PGR of FCPS Community Medicine at Institute of Public Health, and I will be presenting this under the kind supervision of my professor and supervisor, Professor Dr. Saira Afzal, who is the Dean of IPH Lahore. The learning outline for today's presentation would be Introduction to Health Policy, Importance of Health Policy, Objective and Components, Types of Health Policy, the Policy Making Process, Health Policy in Pakistan, Achievements and Challenges of Health Policy in Pakistan, and the multiple choice questions. Learning outcome. By the end of this presentation, the participant would be able to describe about the importance, components, and objective of health policy along with the health policy of Pakistan, its achievements and challenges, and to be able to answer the multiple choice questions. Introduction. The World Health Organization defines health policy as decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. It defines a vision for the future, which in turn helps to establish targets and points of reference for the short and medium term. It outlines priorities and the expected roles of different groups. It builds consensus and informs people. Importance of health policy. In today's world, increasing disease burden, rising healthcare cost, and changing population needs have made strong health policies more important than ever. Health policy is more important than a composite of individual policies targeting health. It is a set of principles, ideas, rules, and boundaries that provide the foundation on which individual policies are structured. It provides us framework for organizing, financing, and delivering healthcare services in a country. Through effective policies, resources are used widely, health inequalities are reduced, and quality care is made accessible to all citizens. A well-designed health policies focuses not only on treatment, but also on prevention, health promotion, and protection of vulnerable groups. Therefore, health policies play a vital role in achieving better health outcomes and substantial national development. The objective of health policy. Following are the main objective of the health policy: universal access to healthcare, equity and justice, disease prevention, health promotion, affordable and responsive service, quality improvement, and strengthening of the health system. The component of health services. The health services comprises of following component. The six major components are the building block of health system, and the rest of two are different. The six important components are healthcare service delivery, healthcare financing, human resource for health, essential medicine and technology, health information system, and health governance and leadership. And the other two components are the cross intersectoral linkages and global health responsibilities. The type of health policies following are the types of health policies. There are macro policies and micro policies. The macro policy is basically a systemic policy. For example, the mode of financing and regulation of private sector, while micro policy is a aspect of program policy. For example, changes in vaccination policy, breastfeeding education, they all are example of micro policies. Then there are regulatory health policies and allocative health policies. The regulatory health policies are the health policies which may be used as a regulatory tool that can call on government to prescribe and control the behavior of a particular target group by monitoring the group and imposing sanctions if it fails to comply. For example, prohibition of smoking in public places and licensing of medical professionals. And then the other category is allocative health policies. The allocative health policies involve the direct provision of income, services, or goods to certain group of individual or institutions. They can be distributive or redistributive. The distributive kind of allocative health policies are the regulations that provide benefit or services to the targeted population or subpopulation, typically as entitlements. It spread benefits throughout the society. For example, provision of public health and health promotive services, training of medical personnel, and construction of healthcare facilities. While the redistributive policies are the deliberate efforts to alter the distribution of benefits by taking money or power from one group and give it to the another, like taking tax revenue from the more affluent resident and spend it to provide free or low cost health insurance to the poor. This typically creates visible beneficiaries and payers, for example, social insurance programs. Now, there are some determinants of health policy which play an important role in the formation of policies. So, there are broad determinants of policy, and there are then narrow determinants of policy. The broad determinants of policy are the nature of health problems for which the policies are being making. Then there are socio-cultural norms that influence the perception of the problem and the political system within which the policy is formulated. While the narrow determinants are the potential solutions to the identified health problem, views and efforts of the stakeholders, demonstrated leadership of the policymakers, and available resources needed to the implementation of that policy. So, this is basically a conceptual framework of health policy determinants. The three important components which are present outside the sphere, they are basically the broad determinant of health policy, which includes the political system, the health problem, and the socio-cultural norms. While there are four components which are present inside the circle, which shows the narrow determinants of the policy, and it includes leadership, resources, solution, and the stakeholders which affect the policy, and they all ultimately lead to the determine how the policy would be formed. So, the forces which play a major role in the policy process, which are also known as the policy shapers, there are following categories. One is individual citizen, then there is a group of pressure groups, which include the legislative executives of Prime Minister office, then their bureaucracy and judiciary plays a major role, and there are certain special institutions like Planning Commission, National Security Council, and National Reconstruction Bureau. Then also media, political parties, social and economic factors, interest and perception of policymaker also plays an important role. Then there are certain non-government organizations, public-private partnerships, and even the global civil society plays a role in the policy process. The next is the policy levers or the instruments of policy, which are basically needed for the effect for throughout the policy process, and it includes the payment, regulation, organization, financing, and behavior. Next is the requirements for an effective policy. For an effective policy to be made, certain criteria has to be fulfilled. The first one is there should be a situational analysis using the tool of policy. The tool of policy includes the burden of disease, national health accounts, and performance assessment. So, before even starting the making policy making process, these criteria should be kept in mind. The next is funding, then training, community involvement is also important. Then there is public private partnership plays an important role. Stabilize population, and monitoring and evaluation, and in the end accountability and transparency. So, we have a very famous criteria for the formation of an effective policy, which is basically known as Lashari criteria, and it comprehensively defined the criteria which I have mentioned previously, and it has five important indicators. The first one is that the policy should have a empirical record from the past. Again, situational analysis is important. You need to do a detailed situational analysis for the health in order to make the health policy. The policy should be evidence based, it should be intersectoral, and there should be a cost effective analysis of the objective of policy should be done, and there should be clear definition of the roles of federal, provincial, and district governments in the health policy. Coming to the policy making process, the policy making process is best described by stages heuristic. It is the best known framework for policy cycle, and it begins with the agenda setting, policy formulation, legitimization, policy implementation, evaluation, and policy maintenance, and which ultimately lead to the succession or the termination of the policy. Then the next important framework is the CDC policy process. And again, it has five main domains and two overarching domains. The five main domains includes the problem identification, which basically is included into the agenda setting. Then a policy analysis is done in which in which identification of different policies option to address the problem and how they will impact. The third domain is the strategy and policy development. So identify the strategy for getting the policy adopted and the how policy will operate. Then the next important step after the development of the policy is policy enactment, which is basically done through the legitimization or through legal aspects. So the process of getting policy enacted or passed. And in the last step, the policy implementation is done. The translated or legitimized or enacted policy is then placed into action, and which ultimately defines whether the policy will be succeeded or terminated. And the next, it has two overarching domains. Basically, these overarching domains affect the main five domains, and it involves the stakeholder engagement and education. And all the stakeholders which are involved in the policy process, we have described their names earlier. And then evaluation, which is done for the impact and outcome of the policy, and it involves both kind of evaluation, like formative and summative evaluations, which are done before the implementation of the policy and after the implementation of policy as well. The next process is the process after the formation of the policy is the health policy analysis, the process of identifying health priorities, suggesting strategies and intervention based on available spending options that are technically, politically, and socially appropriate is known as health policy analysis. It explains the interaction between institution, interest, and ideas in the policy process. It is useful both retrospectively and prospectively to understand past policy failures and successes, and to plan for future policy implementation by developing better political strategies. So we have two types of policy analysis. Either it is retrospective or descriptive analysis, or the prospective analysis. In retrospective policy analysis, the analysis of policy looks back at why or how a policy made its way onto the agenda, its content, or whether or not and why it has achieved its goals. So, in perspective analysis, as the name indicates, it is usually carried out to inform the formation of a policy or anticipate how a policy might fail or succeed if it is introduced. So steps in the analysis of policy includes identifying or framing a problem, then identifying who is affected, identifying and comparing the potential impact of different effects, then options for dealing with the problem, choosing among the option and implementing the right chosen option, and then in the end evaluating the impact of that chosen option. So the policy analysis is usually done by using the Walt and Gilson policy triangle framework. The policy triangle framework is grounded in a political economy perspective and consider how all of four these elements interact to shape policy making. The triangle has basically three important component and one in the center. So there are four important components which affect the policy analysis, which include context, actors, processes, and content. So in this triangle, you can see that on the top there are context, that where will be the where will we apply the reform. Okay, what are the implications for structure and services, and what is the context to those policy? Then the next is content, which basically defines what aims to achieve the reform. And on the third angle, there is process, which defines how the reform will be implemented and who decides the health players that involve. And in the center, there are actors who are basically the participants. So in policy analysis, the analysis done for all of these important contents, the context involve the analysis of democracy or autocracy, decentralization, political stability, national policies, privatization, liberalization, free market, relation with the developmental partners, donor countries, and even in before the economic growth. The content for the policy analysis include the health system policy, health determinants policy, and health program policy. It is the policy is also evaluated for values like equity, transparency, accountability, efficiency, social justice, human rights, ethics, solidarity, subsidiarity, effectiveness, participation, evidence, and liberalization, which basically affects the actors. Then there is for the process, the evaluation it take place, who initiated the policy issue, how participatory was the process, how was the final decision for the analysis taken, was it based on evidence, instinct, or the political expediency, or was there any external pressure, was there consensus present, or what are the constraints to the implementation of that policy. And in the end, it is also done for the outcomes. So in outcome, there are certain intrinsic goal and instrumental goals. The intrinsic goals are analyzed for as reduced mortality, morbidity, fertility, disability, fairness of financial contribution, and responsiveness. While the instrumental goals for which analysis of policy is done is again the access, quality, efficiency, and equity of the health services. So coming to the health policy in Pakistan, the health policy in Pakistan is formulated by the National Health Policy NHPU unit, which includes basically two important groups. First is the Ministry of Health, and second is the think tanks. Think tanks include the Pakistan Health Policy Forum, which is basically located in Islamabad, and the other center is REACH, which is the Research and Advocacy Center for Health Policy located in Lahore. So the process of policy formulation in Pakistan starts with the board formation, and it includes the 20% professional people, 20% participation from the pressure group, and 50% from the community. So from this board formation, subcommittees are made, which write report on priority areas, and the first proposal is then sent to the Secretary of Health or Ministry of Health. And the apart from the subcommittee's report, there are proposal from every province as well. So they combine the proposal of the secretary health and then the proposal from provinces, and all of this combined to form a draft which is sent to the planning commission and Ministry of Finance and the federal health minister. And after the reviewing of the federal health minister, the final draft is sent to the cabinet, and in the cabinet then the policy is approved. It is then announced, and it is then present in the National Assembly. And after the presentation in National Assembly, it is then presented in Senate. And after from the approval of the Senate, it is ultimately approved by the President of Pakistan, and then it is implemented. It can be a 5-year plan, and the policy. Then after the implementation, after the basically approval of the policy, it is then implemented, and for the implementation, 5-year plans and projects are made, and the monitoring and evaluation is then done periodically for the implemented policy. So, after the approval of the policy, a document which is known as Public Sector Developmental Program is made, which is basically an annual document which lists all the public sector projects program with specific allocations made for each one of them in that particular financial year is made. This is basically a document, and then there are developmental plan as well, which is a forward-looking policy framework which envisages a concrete, prioritized, and flexible program of action to attain specified economic and social objectives. So the current national health policy of the Pakistan is National Health Vision of Pakistan, known as 2016 to 2025. So why this national health vision was implemented and formed, basically there were certain background issues because of the partial implementation of the national health policy of 2001, and 2009 policy was not approved, leaving health issues mostly unresolved. There were double burden of disease in Pakistan, which were worsening the population, which was worsened by the population explosion and inefficient health system. There were poor governance, and basically the health system in Pakistan is mixed type with up to 70% out of pocket spending, which is huge. Then there were new challenges which was created by the 2011 health devolution. The millennial developmental goals of 2025 were not completely achieved, and there were more ambitious sustainable developmental goals were launched. So there were issues in the monitoring of progress as well. So all of these issues led to the formation of National Health Vision of Pakistan. Again, though the health sector has been devolved to the province in 2011 devolution, international agencies treat the country as one unit. For example, if there are 13 SDGs, and for example, one province is acting and achieving the goals better, but on international level, so the combined effect of all the provinces is quoted, and the international level one indicator has to be quoted. Individual performance of the provinces is usually not quoted over there. So this led to the formation of National Health Vision of Pakistan, which states that the National Health Vision of Pakistan 2016 to 2025 is to improve the health of all Pakistanis, particularly women and children, through universal access to affordable, quality, essential health services, and delivered through a resilient and responsive health system, ready to attain sustainable developmental goals and fulfill its other global health responsibilities. The guiding principle of this national health vision is A, good governance, B, transparency and accountability, C, equity and pro-poor approach, D, responsiveness, E, innovation and transformation, and F is the integration and cross-sectoral synergies. The objectives of the National Health Vision of Pakistan is to provide a unified vision to improve health while ensuring provincial autonomy and diversity, build coherence to the federal and provincial efforts in consolidating progress, learning from experiences, and moving towards the universal health coverage, facilitate synchronization for commonality across international reporting and international treaties, facilitate coordination for regulation, information collection, surveillance, and research for improved health system, and to provide a foundational basis for charting and implementing SDGs in partnership with other sectors. So the main objective of National Health Vision of Pakistan is basically to move Pakistan towards the universal health coverage. So again, the National Health Vision of Pakistan is built in under the 8 thematic pillars. Again, 6 of them were the main building blocks of the health system. So National Health Vision builds its narrative on the following thematic pillars. These 8 pillars, 6 of these are health system building blocks, will pave a way for ensuring access, coverage, quality, and safety, which are essential requisite for achieving the ultimate goals of health system. And for each pillar, there was strategic vision was described. For the healthcare financing, the strategic vision was that there should be increased allocation to health to 3% of the GDP, attain universal health coverage, national health insurance scheme should be there. Then there should be nutrition and investment, fiscal discipline, revisit formula of district allocation, and revisit the health priorities, and enhance resource mobilization from official developmental authorities. Then there were the strategic vision for service delivery was introduced in the essential service delivery packages, which include family medicine, newborn survival, birth spacing and contraceptive supply, non-communicable disease, mental health, undernutrition, disabilities, and problem of aging population, ensure minimum service delivery standard, MSDs at all levels, integration of vertical program at the provincial level, because the vertical programs are basically led by the federal government, enforcing the public health laws promulgated related to the smoking, drug safety, organ donation and transplantation, safe blood transfusion, environmental protection and food safety, and in the end, a resilient health system to disaster and emergencies. The strategic vision for the human resource for health, that education should be tailored according to the health needs of population, focusing on social determinants of health, ethics, and public health laws. There must be skill mixing, task shifting, responsive management, develop national health human resource strategy, and nursing strategy and human resource database should be there. For health information system, it was vision that innovative technologies to support evidence-based decision at the district level through district health information system, monitoring the sustainable developmental goal as well as the national health targets, and inform on vital events. Transition from medical research to the national health research prioritizing areas, and there should be a central hub for information repository, standardization and quality, and effective integrated disease surveillance response system should be there, focusing on early warning signs. And then for the governance, there should be sector-wide strategic planning, accountability mechanism, and innovative management models of primary healthcare. For essential medicine and technology, there should be health technology assessment best practices, pharmacovigilance program, drug policing program, policy for orphan drugs, alternative medicine and medical devices, strengthening of Drug Regulation Authority of Pakistan, and effective legislation. And for cross-sectoral linkage, it was vision as one health and health in all policies, joint effort on sustainable developmental goals from different sectors, community involvement, and women empowerment. And global health responsibilities included coordinated response to the event that may constitute a public health emergencies of international concern and public health emergencies of national concerns, polio, adherence to international treaties like IHR 2005, Global Health Security Agenda, and Sustainable Developmental Goals. So there were certain strengths and weaknesses of the National Health Vision. The strength of the National Health Vision was it first time addressed the building block of health system. It focuses on the accountability mechanism. It advocates for the National Human Resource for Health Strategy formulation for the first time. It advocates for the National Human Information System, Health Information System, and it defines standard for service, equipment, and staff in government plus private hospitals. It focuses on health insurance and intersectoral scope. It focuses on global health responsibilities as well. And for the first time, the funding in health sector has been declared as investment rather than an expenditure. While there were certain challenges to the National Health Vision 2016, again, the most important was the allocation of fund. The federal provincial dynamics played as an important role. There are certain federally led vertical program. They are thin in terms of staff and lacks dedicated strategy, policy, and information units to coordinate effectively. The provinces, they have constant transfers in health bureaucracy that prevents any vision, and there were reliance on the international donor to fund the health vision, which is basically a drawback and a challenge because the government needs to set the priorities in human development. So overall, there are certain factors which affect the policy implementation. Again, the most important of them is the complexity of the policy, and political will and government capacity plays a major role. The transparency and efficiently working a health system. Institutional strength plays an important role. Strong governance and accountability mechanism make the implementation policy easy. The managerial authorities and decision making. So excessive centralization of decision making majorly affect the implementation of policy, because within ministries and related administrative units, they basically cause an unnecessary delay in the implementation process. Delegation of appropriate powers to program managers and senior administrators. And again, there are political and external interference in decision relating to the recruitment, transfers, and disciplinary action is also an impediment to the efficiency, in addition to being a demoralizing factor in the public sector. So all of these factors, they in fact affect the policy implementation in the country. Coming to the recent update, this was present on the website of the Press Information Department of the Ministry of Information and Broadcasting, Government of Pakistan. So the ministry shared that the Government of Pakistan is in the process of finalizing the National Health and Population Policy of 2026 to 2035, which envisions ensuring access to essential healthcare for every citizen and promoting overall well-being through improved health, nutrition, and population balance. The policy also emphasizes on the self-reliance in vaccine production, introduction of digital technologies such as telemedicine, and introduction of one patient, one ID for efficient data management and universal medical records. So these are the few things that will be incorporated into the upcoming policy, which is being under the process of finalization. Now it's time for the multiple choice question. The first MCQ is: a new health insurance program improve access but increases cost. What should policymakers do? A, cancel program. B, ignore cost. C, reanalyze and modify policy. D, reduce coverage. E, privatize hospitals.
C.
Yes, C is the right answer. Reanalyze and modify the policy. The second MCQ is: a policy improves hospital infrastructures, but patient outcomes remain poor. The main weakness is in A, financing, B, governance, C, infrastructure, D, service quality, E, legislation.
D.
Yes, D is the right answer, service quality. The third MCQ is: of health, if a health policy is technically sound but politically unacceptable, it will most likely A, be delayed, C, be modified, C, fail to be enacted, D, be evaluated, E, be partially implemented.
C.
Yes, C is the right answer. It will, if it is politically unstable, unacceptable, because it has to be approved by the Senate, so it will be failed to enacted. The fourth MCQ is: a province implement national health vision goals differently due to local need. This reflects A, centralization, B, fragmentation, C, commercialization, D, privatization, E, decentralization.
E.
Yes, D is the right answer, because after the devolution, the powers are decentralized to the provinces. So fifth MCQ is: if monitoring data is collected but not used for decision making, the system suffer from A, information overload, B, policy paralysis, C, poor feedback loop, D, overregulation, E, financial leakage.
C.
C.
Yes, C is the right answer, poor feedback loop. The sixth MCQ is: under National Health Vision of 2016 to 2025, which reform most directly support long-term system resilience? A, construction of mega hospital. B, strengthening of health information system. C, import of medical equipment. D, short-term donor project. E, overseas training program.
B.
Yes, B is the right answer, because if you have a strengthened health information system, so it will you have the data of your population, and ultimately you would have the evidence for making the research according to the health need of the people. So the seventh MCQ is when evaluation shows that a policy improved averages but widened the health gap. This represents failure in A, equity, B, efficiency, C, effectiveness, D, substantiality, E, transparency.
C.
No,
C.
the right answer is basically A, equity. So when overall average of the country is improved, but the health gap has increased, so it has to do something with the issue of equity. The eighth MCQ is which stakeholder plays the key role in policy approval in Pakistan? A, NGOs, B, bureaucracy, C, parliament, D, community leaders, E, judiciary.
Charlie.
Yes, C is the right answer. The ultimate authority for passing the policy in Pakistan is the parliament or senate. The ninth MCQ is which domain ensures the fair distribution of health services? A, efficiency, B, equity, C, productivity, D, equality, E, profitability.
Equity.
Yes, equity is the right answer. The last MCQ is a policy achieves high coverage but low utilization among women in rural areas. The most appropriate analytical explanation is A, budget constraint, B, weak monitoring, C, socio-cultural barrier, D, poor legislation, E, staff absenteeism.
C.
Yes, again, C is the right answer. Socio-cultural barrier plays an important role in the policy determinants. This is the key to all MCQs. These are the references. This is the official channel of the YouTube of Institute of Public Health where the recording of this presentation will be uploaded. And thank you for your patient listening.